Well, thank you, Madam Speaker. I'd like to start by recognizing the personal and economic sacrifices Canadians have made during this pandemic. They did everything that was within their control to do. They stayed home, they followed public health orders, and they suffered hardships. Families across this country are grieving the 23,756 people who have died. Since the first weeks of the pandemic, I've advocated for the approach that Taiwan took. At the beginning, Taiwan was one of the top 10 countries affected. Now they are ranked 191. Taiwan applied what they learned from the SARS outbreak. They had a mask mandate and they gave every resident 3 masks per week. They installed hand sanitizer at the entrance to every building. The Army worked with manufacturers to expedite the production of personal protective equipment, and they had huge fines for PPE hoarding and profiteering. They had testing and temperature checks for interregional travel, and they had tight controls on their border, and travelers returning home faced mandatory quarantine. These actions protected their economy. They never had a lockdown like the ones that we've had here. Earlier in the pandemic, the Green Party caucus advocated for the government to invoke the Emergencies Act using the provisions of a public welfare emergency. It's a very well-written piece of legislation that replaced the old War Measures Act. Invoking it would have allowed the government to create a federal coordinated response with the provinces, close the border, mandate quarantines for people returning to Canada, control interprovincial and interregional travel, create green zones for opening the economy and red zones to control areas where there was community spread with lockdowns. All things that were done in New Zealand and Australia and other countries that successfully fought the pandemic. But our calls to invoke the Emergency Act were ignored. Whether the Emergencies Act was the right tool for the job or not, it is clear that stronger national coordination has been sorely missing in Canada's approach to dealing with the pandemic. Then we need a federal provincial task force to create better coordination. Just last month, during an adjournment debate, I pointed out that the one thing that all countries that went to zero had in common was a coordinated national strategy. I argued that it was not too late for a national strategy. In fact, we need it more than ever. In response, I was scolded by the parliamentary secretary and told that I didn't understand the Constitution and that the government did not want to cause a constitutional crisis. I was floored by the weakness of that argument. Almost 24,000 people have died. The economy is struggling. We have the largest deficit in Canadian history. 180,000 small and medium-sized enterprises across this country are on the verge of closing permanently. Millions of Canadians are financially stressed. We have a mental health crisis, the suicide rate is up, and we have a shadow pandemic of intimate partner violence. Drug overdoses have increased. We are in a third wave of the pandemic with variants spreading rapidly and more cases than ever before. We have another series of lockdowns in Canada's biggest provinces, and Canadians are angry, scared, and fed up. Our governments have done a poor job of coordinating the fight to end this pandemic, but at least we managed to avoid a constitutional crisis. Canadians are looking at what is happening in other countries, and it's not lost on them that our strategy in Canada isn't working. Inadequate coordination between the federal, provincial, and territory responses has failed to stop the spread of the virus. We're using a yo-yo method of lockdown, opening up, and lockdown again to try to limit the pandemic rather than employing a get-to-zero strategy. In countries such as New Zealand, Australia, Taiwan, and South Korea, the spread of COVID-19 has been arrested. Case levels are down, the death toll is lower, the economies are up and running, and people are going about their lives. What can Canada learn? Where did we go wrong, and how can we move forward in a way that will result in less hardship for Canadians? Countries that have eliminated the spread of the disease share these key aspects. They had a national strategy. They closed borders. They required quarantines for citizens returning from international locations. They limited international travel within the country. They created red zones to lock down and green zones where the economy could stay open. They mandated masks for indoor public spaces. They tested widely and used contact tracing. They continued to use circuit breaker lockdowns to quickly stop new outbreaks in specific areas. The key to success was to isolate outbreaks and use multiple tools to limit the spread of the virus. These are actions that the Green Party MPs advocated for in the early days of the pandemic. Instead of a well-coordinated national strategy, Canadians had a patchwork of provincial health orders that were often contradictory and confusing. In some cases, COVID-19 related decisions appeared to be driven by politics instead of science. In BC, during the lockdowns, when the rest of us had to remain at home, workers continued to travel in and out of camps to construct the Coastal GasLink and Trans Mountain expansion pipelines and the Site C Dam. This has led to the spread of COVID in remote northern communities. When Newfoundland thought that they had the spread of COVID under control, workers from the camps in the oil sands brought COVID home with them and contributed to the spread there. The border to the US has been technically closed for a year, but there is a real lack of control over travel. Since April 6, more than 100 international flights landing in Canada have carried at least one positive COVID-19 case on board. The Deputy Chief Public Health Officer stated that we know that with viruses, it's practically impossible to prevent new variants from arriving in Canada. But other countries have been successful in stopping the spread of new variants by travelers. It may not make sense to target specific countries anymore, but we can control air travel the same way that New Zealand and Australia have. I appreciate the fact that the government organized an intergovernmental coordinating committee with medical health officers from the country, across the country. But we needed more than a committee. We needed more than a patchwork of confusing protocols and mandates that change from province to province. Canada is a federation, and it is true that the provinces have jurisdiction over healthcare. I understand that the federal government is reluctant to use the emergency powers to create and enforce a national strategy. Some provincial governments have at times politicized this pandemic. Such actions have been detrimental for Canadians. The Emergencies Act may not be the right tool, but we have to stop letting the dysfunction in our federalist system get in the way of a more coordinated response. Australia is also a federation with jurisdictional and political differences between the national and state governments, but they work together successfully to stop the spread of COVID-19, and the population there is much better off for that coordination. The vaccines are finally starting to roll out across the country, but the spread of the new variants is not yet certain how effective the vaccines will prove to be. We need to be prepared to stop the spread of variants that may be vaccine resistant. We're not out of the woods yet, and a lack of national coordination can still have dire consequences. There's been a lack of political courage to do what is necessary at the federal level in Canada. On both sides of the House, there is little appetite to do anything that might upset a provincial premier. But the lack of a unified national COVID-19 strategy continues to have poor outcomes and hurts Canadians in a myriad of ways. We need stronger national coordination, and the sooner we start, the better the results we will achieve. Pandemics do not respect jurisdiction. Let's stand together as a nation, get to zero, and beat COVID-19. Thank you.
Questions and comments. Questions et commentaires. The honourable member for Kingston and the Islands.
Thank you very much, Mr. Speaker. And I will say I'm a little bit perplexed at the interventions that I've heard so far in this debate from both members from the Green Party. There seems to be, I think that this is going to be a healthy discussion and we need to have it, but I really think we need to set the context right to do that. And I'm not, what I'm hearing is the Green Party members try to compare Canada to really non-comparables. Like if you look at Canada versus what's been going on in Europe, Europe has a lot of land borders, like Canada has the largest land border. Or if you look at Canada compared to the United States, for example, I think that we fared better when you look at those more realistic comparables, like our G7 partners. We have our G7 countries. We have the second lowest death rate per capita. So I think that there's going to be good value in this discussion, but I really think it's necessary to frame it properly so that we don't go off the rails right at the beginning. Would the member not agree that it would be better to compare us to our G7 counterparts as opposed to New Zealand or Australia that are quite different in geographic makeup and give them an advantage?
The honourable member for Nanaimo, Ladysmith.
Well, New Zealand and Australia stopped flights from coming into their country with people with COVID. They have a definite plan on how that happens. And we have not managed to do that just with flights into Canada, let alone our long border. I understand that we have a long border with the United States, and that is a serious challenge for us. But just on flights coming into Canada, when there's been 100 flights that have had COVID on the flight since April 6th, we've heard other members get up and say that they know people who came in from other countries where COVID was spreading, where there weren't controls. And so there are controls that we could have and things that we need to do.
Questions and comments? Questions et commentaires. The honourable member for Cowichan-Malahat-Langford. Okay.
Thank you, Mr. Speaker, and thank you to my colleague from the neighboring riding of Nanaimo, Ladysmith. And, I very much agree with him about the comparison with Australia. My in-laws all live in Tasmania, and when we're on Zoom calls with them, we look at envy as they're able to travel to restaurants and enjoy a semi-normal life. I very much agree with his application of the Emergencies Act. I think the times call for us to look at that piece of legislation, and I think it was very unfair for the Prime Minister today during question period to make a comparison to the War Measures Act, because we all know they are two very different pieces of legislation. My question, Mr. Speaker, is really to do with the very vulnerable set of workers, racialized workers, those who work in tourism and arts and entertainment. Would he not agree that the budget's announcement of having the CRB reduced by $200 in July is precisely the wrong approach at this point, because we don't yet know how this pandemic is going to play out. And I think we need to give those workers all the support they need for the near future, at least. Would he not agree that we should be keeping that to the current level that it's at? Thank you.
The honourable member for Nanaimo, Ladysmith.
Well, thank you, Mr. Speaker. And I'd like to thank my honourable colleague from Cowichan-Malahat-Langford as well, my neighbour. And I agree. We need to continue to protect workers. And one of the things that we've seen is a reluctance, on the part of the Ontario government to have sick leave. So vulnerable people who we rely on to maintain, keep grocery stores open, are going to work sick because they don't have any other choice economically. And so, we need to stand up for workers and we need to protect workers. It's really important that we help to get through this. And I can't understand how, workers who are flying in, for these man camps got in line for COVID vaccines before our teachers did, or before our grocery store workers did. Where are our priorities? Our priorities are on resource extraction. When we, Coastal GasLink doesn't matter right now. What matters is getting through the pandemic.